What we want to do here is provide a safe workplace for coworkers and for people going into work. And what this rule does, what this emergency temporary standard does, is pretty simple. It asks employers to have their employees vaccinated, and if their employees don't want to get vaccinated, they get tested once a week, and when they're in work, they wear a mask.
Labor Secretary Marty Walsh defending those new vaccine and testing requirements for companies with 100 or more employees. It comes amid pushback over 24 states and a new legal challenge in court. Here to discuss is the U.S. Surgeon General, Dr. Vivek Murthy. Good morning, Dr. Murthy. Let's start with those legal challenges. The Fifth Circuit Court of Appeals yesterday blocked the mandate, citing grave and statutory and constitutional issues. I know you're not a lawyer, but is the administration confident this can survive the legal challenges?
Well, Martha, the president and the administration wouldn't have put these requirements in place if they didn't think that they were appropriate and necessary, and the administration is certainly prepared to defend them. But let's step back for a moment and just look at why these are so important. Throughout our history, we've seen that we have used vaccine requirements to protect the population. It started back with George Washington, in fact, when he required troops to be inoculated for smallpox. In the 1800s, schools started having vaccine requirements. When you think about the workplace, in particular, it's so important that our workplaces are safe, that workers feel safe there, that customers also feel safe. And we know that at this point in the pandemic, when we've come so far, but we still have 75,000 cases a day, that it's important we take every measure possible to make our workplaces safer. It's good for people's health, it's good for the economy, and that's why these requirements make so much sense.
And obviously, everyone does not agree with you. At least 27 states have filed suit against the rule. One suit claiming this unlawful mandate will cause injuries and hardship to working families, inflict economic disruption and staffing shortages on the states and private employers, and impose even greater strains on struggling labor markets and supply chains. What's your response to those who say this is an overreach and will hurt the economy?
Yeah, I'll tell you what I hear time and time again from small businesses, large businesses, and workers is that what's really hurting the economy is actually COVID itself. Millions of workers have gotten sick because of COVID and unpredictably been pulled out of work. Millions more have had to be quarantined. And think about how disruptive that's been to businesses. And one of the reasons why you see thousands of companies actually already moving forward with requirements even before the federal deadline is because they've realized how important and helpful it is for the health of their workers and for the health of their businesses to have everyone vaccinated. Finally, just keep this in mind. These are not new. In addition to having done these historically, in modern times, we have required vaccines for the military. We've required vaccines in hospital systems, the ones that I've worked in as well. There are times where we recognize that our decisions have a broader effect on people around us. COVID has reminded us of that. And that's why having these types of requirements in workplaces will be not only helpful, but it's a necessary step to accelerate our pathway out of the pandemic.
And Dr. Murthy, if the law survives legal challenges, will the administration be extending the mandate to smaller employers with fewer than 100 employees?
Well, Martha, certainly nothing is off the table at this moment, but the focus right now is on implementing the current rule that OSHA put out. And finally, let me just emphasize that these rules actually work. What we've seen in a report issued recently was that on average, businesses that put these requirements in place see a 20% increase in vaccination rates, often boosting them into the 90s. So if we realize, as we have over the past year, that vaccination is one of our key pathways out of this pandemic, these requirements will do a lot to get us toward the finish line.
And former FDA Administrator Scott Gottlieb told CNBC this week that the U.S. could be mostly through with the pandemic by the time these mandates are put in place. Is he wrong?
Well, I'm cautiously optimistic about where we are, Martha, and let me tell you why. Because at this point, we've gotten over 190 million people fully vaccinated in our country. We now have a vaccine for children 5 through 11 that's 28 million more people who now have the opportunity to get vaccinated. We have our kids back in schools. We have 2 very promising clinical trials for oral medicines, which have to go through a full FDA review, but give us hope that an effective oral treatment may be on the way. So I think we've made a tremendous amount of progress. But if COVID has taught us anything, it's that we can't take our foot off the accelerator until we're at the finish line. And that means we've got to continue on our work to get people vaccinated in this country and take precautions until that job is done.
And Dr. Murthy, you mentioned that antiviral pill. Pfizer announced Friday they have this new antiviral pill, which they say reduced the risk of hospitalization and death by 89% in high-risk individuals. If this drug gets approved, what impact could this have?
Well, that was certainly very good news, Martha. And this is now the second pill that we've seen, this first one being molnupiravir, which showed promising results in clinical trials. Keep in mind that these trials that Pfizer announced recently, these were in people who were higher risk, and it reduced their risk of hospitalization and death by 89%. But 2 critical things to keep in mind here. One is that these medicines still have to be fully evaluated by the FDA before they're made available. But the second is that there is a 100% effective strategy to avoid hospitalization and death, and that's not getting COVID in the first place, which is why taking appropriate precautions and getting vaccinated still must be at the heart of our strategy. A therapeutic, a pill, is not a substitute for getting vaccinated.
And Dr. Murthy, just quickly, if you can, you mentioned also the vaccine for children, big news this week. But do you expect the same rate of breakthrough cases with children who are vaccinated?
Well, certainly we've seen very good results in the clinical trials, a 90% effective rate, closer to 91%, in fact, among children, which is great, and a safety profile that's really strong. We're going to continue to follow children over time. But those results were very, very promising. And it's one of the reasons why I'm planning to take my 5-year-old to get vaccinated as soon as possible.
Okay, thanks so much for joining us this morning, Dr. Murthy.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.